Welcome to Women of the Wise Path, a place for fostering open discussions about womanhood in our new world paradigm. We are a collective of holistic practitioners, coaches, and leaders devoted to supporting women as we navigate the shifting landscape of our times. Through conversations on health, culture, spirituality, motherhood, partnership, business, and transformation, we intend to spark connections, bridge generations, and share wisdom about what it means to support women of today. Welcome to Women of the Wise Path.
Hello, everybody, and welcome to Women of the Wise Path, where we talk about what it means to be a woman today. I'm Mary Crawford, and today I have the pleasure of speaking with Dr. Victoria J. Mondloch. Dr. Mondloch is a recently retired physician from Waukesha, Wisconsin, president and founder of Victoria J. Mondloch, MD-SC. She was also the medical director of Wisconsin Stem Cell LLC. With over 35 years of experience, she specialized in women's health, family medicine, and preventive health and wellness. Dr. Mondloch earned her medical degree from the Medical College of Wisconsin. Her approach was to educate and empower her patients to better understand their bodies and maintain healthy lifestyle habits. Dr. Mondloch specialized in bioidentical hormone counseling for women and men. Recognized as a VIP Woman of the Year by the National Association of Professional Women and Medical Director of the Year 2020 by IAOTP, as well as IAOTP Most Empowered Female Physician of 2022 and Lifetime Achievement 2023. Welcome, Dr. Mondloch. It's so good to have you here.
Thank you, Mary. Pleasure to be here.
It's so great. So at Women of the Wise Path, we're about what it means to be a woman today. And science has changed so much in the past 20, 30, even last 5 years, right? You've been involved in stem cell research and all of that. That's pretty new. And the hormone, I love your book. We're going to talk a little bit about your book, Full Bloom, which I know you have another one, the Blossoming, is it called? The first one?
Correct. Blossoming, Becoming a One.
Okay. Perfect. So there's a lot of young women out there who could really use that one. But Full Bloom is about, how do we handle all the things that trip us up a little bit as we become more mature women, as we go past childbearing years. And so I want to talk a little bit about that book today too. But my first question to you is you've done a lot of work with women over your whole career, and how can we support women as they step into power and remember who they are, because sometimes perimenopause and menopause and all of that can really make you feel less than, not good enough, falling apart.
Well, right. And, first and foremost, we always are better taking care of others than ourselves. So we have to learn that it's okay to take care of our own health. We caregive our family, we caregive our neighbors, we caregive our parents, we caregive our children, we caregive the neighbor's dog, we caregive the world. And so when we are also successful business women and we're running a company or highly involved at a high level with a company, we also have to remember that our own physical, mental, and spiritual health are hugely important to pay attention to. And we don't get a lot of help from our healthcare practitioners. Women's health is actually minimally science-based. And I say that very deliberately because I'll ask this single question of any woman listening is, when is the last time your healthcare provider said, let's check your hormone levels and see if you're in balance? I will venture to say that probably less than 5% of women listening can answer that question. I have, because it is not part of the usual training that healthcare providers, especially MD doctors, get through medical school. Less than 20% of medical school curricula even address menopause, perimenopause, and what that means, much less what are resolutions, how can we help our patients through these changing times. There are no norms, and that's terrifying, that 50% of the population really has no basic norms for our foundation of our female health.
So where do we go from there? I mean, that's scary, right?
It's extremely scary. So when I realized that perimenopause was hitting me, I addressed what are the symptoms? Why am I feeling the way I'm feeling? This has to be hormone swings. So hello, let's check levels. But yet when you look for the reference range of where you should be, the reference range, which is an antiquated way to look at an evolutionary changing time in your health, is set up for women from puberty to death. Whoa. Well, that's a big range of normal. So you're changing hormone levels in your perimenopause and, try to match that with your symptoms. All you're going to get is you're in normal range, even if your doctor will check it. Well, yeah, of course you're between puberty and death. That doesn't help, right? So we needed, and I needed to take a better look at how do we really help women identify whether they're where they need to be or not. So the conversation really needed to change from, am I in normal range, puberty to death, or am I age appropriate for my age?
Yeah, whole new,
Very different range.
a whole new set of parameters for women. Let me just ask, do you think any of this is being taught in medical school now? Are they getting there?
Again, it's less than 20%. There is no real research that has been done on the normal age appropriate levels for women, except in the world of infertility, where a specialist is looking to completely override a woman's cycle in order to achieve pregnancy.
Okay.
And at the tune of $10,000 to $12,000 a month, and most women's insurance doesn't cover that. That's an exorbitant amount of money for a very few number of specialists to know what those numbers are to try to achieve pregnancy. But that doesn't tell you if that number is appropriate for your age. In other words, they're not telling you many times what your numbers are pre-infertility. They're only telling you, I need to get you to a number of this in order to have this cycle of in vitro work for you. So it's a very different outcome that an infertility specialist looks at versus what the everyday woman wants to know is, why am I suddenly getting migraines before my period? Why am I getting increased acid reflux when I'm eating the same and I'm using the same time frame before I go to bed? Why am I having deep, deep, deep muscular fatigue that I can't get on top of when I've always been able to? Why do I have sleep disturbance? There are so many questions that women don't even realize may pertain to where are my hormone levels.
Yeah. Two things came up as you were talking. I actually went through the IVF hormone shots and all of that. It did not work. However, a year later, I got pregnant on my own. So
Yay.
there you go. Medical system. As I was reading your book, I noticed that you talk about the myths of hormone therapy and hormones in women, and there were 14 different myths that came up, and I'm like, oh my gosh, we are so misinformed, right? So some of the ones that jumped out of me. So a lot of people believe, just let Mother Nature take over, because, why interfere? Mother Nature knows best. Why would you say that's not the best way to go?
Well, number one, we don't even realize that menopause is a little over 100 years old as a term. So when we say let nature take its course, well, that means we're going from having hormone to not having hormone. And back in 1912, the average life expectancy for a woman was 48.5 years old. We didn't get to menopause. So let nature take its course meant we would have died before we hit menopause. What we're doing is living longer these days, much, much longer, almost double that time frame. And we're doing it without our hormone, which was our lifeblood. We don't ask men to do that. Men make testosterone hormone to age 20 or age 100. They still have a 20th percentile of testosterone in their system at age 100.
Wait, how is that fair?
It isn't a question of fair at all. You're right. So was Mother Nature trying to say, I don't want you pregnant when you are in your 50s and 60s? Well, there are more benefits to having our hormone on board than just being able to have a baby. We can actually reverse and prevent Alzheimer's. We can actually reverse and prevent osteoporosis, which is not just your spine or your wrist. I'm talking your jaw and being able to hold your teeth in your mouth without having 20 years into menopause, have your dentist tell you, gee, you don't have enough bone left to hold your teeth. We're going to have to pull them all and you need total mouth implants at the tune of $40,000. What? But I'm ideal weight for height. I exercise, I eat right. Yeah, but you just don't have the right hormone mix in you to protect your bones. So is that fair to women that we just keep them in the dark and not let them know the multiple health risks and the prevention of debilitating disease like Alzheimer's? Or replacing every tooth in your mouth? Is that fair to just go, surprise, gee, guess you need some dental work done? That's really not being fair to the American woman.
Oh gosh, right. So you talk about bioidentical HRT. Tell me a little bit more about what that means.
Well, bioidentical means biologically identical to a human female. In other words, what hormones that the ovary in a human makes is estradiol and progesterone. We also make testosterone, but our main female hormones are estradiol and progesterone. When other American studies, the big study, the Women's Health Initiative was done, they didn't use human-based bioidentical hormone. And your first thought is, well, wait a minute, why not? Isn't that just what you would expect? Is that if you're going to study hormone and hormone loss in women and putting it back, wouldn't you use what your ovary used to make? Well, the way research and the pharmaceutical industry works is research is usually funded by pharmaceuticals, so therefore they donate or include their medications. So WHI, the Women's Health Initiative, which started in 1995 as a 10-year study, was actually done with, are you ready? Premarin, which stands for pregnant mare's urine. Wait a minute, horse pee? Yep. And Prem Pro with the prem of Prempro being Premarin, plus the pro being a synthetic chemical called medroxyprogesterone acetate. So chemical and horse-based. What's bioidentical about that to a human female? Nothing. The Europeans did a mirror study only looking at initially breast cancer, then looking on a second study with heart attack and stroke, but they said we are only going to use human-based bioidentical. And interestingly, the different outcomes of the American study versus the European study were opposite results. The Americans found an increase in breast cancer, increase in heart attack, increase in stroke. The European studies found a decrease in breast cancer, decrease in heart attack, decrease in stroke. It's mind-boggling when you have it presented in front of you. What possessed the Americans to not put human-based bioidentical? Oh yeah, the pharmaceutical industry. Correct. But know that the Americans did try to save face, and they repeated a study that took the Premarin and still studied Premarin, but took out the Prempro, but added in the estradiol and the progesterone. Okay. What did the American study find? Even keeping the Prempro in, they found the decrease in heart attack, decrease in stroke, decrease in breast cancer, but additionally, decrease in osteoporosis and reversal back to normal, and decreased incidence of Alzheimer's.
Wow. Huge.
Wow.
Yeah.
But shh, we can't talk about that because that's going to embarrass all those big universities that were involved in WHI, like Harvard, Duke and Yale and USC and UCLA and all these big universities with very prominent researchers that were involved, and they might lose funding, and oh my goodness, they might lose future grants. So we just won't talk about that.
Wow. Even today.
Even today.
Wow.
I would beg to ask the question of how many people have heard of WHI, Women's Health Initiative, which is a lot of people. Okay, that's what that Premarin Prempro study was. That's still considered the gold standard in the world of medicine, versus the KEEPS trial, KEEPS, the KEEPS trial, which was putting the American and European together, that the Americans studied with estradiol and progesterone added. And very few people, even physicians, know about the KEEPS trial, yet it was done in 2016.
Wow. Okay. So, wow. There's so much to go on here, so much to talk about. One of the things that you talk about in your book is that we don't just need to look at the female hormones. We also need to look at thyroid hormones and the adrenal glands, and how do these work together, and why is it important that they do work together?
Well, our body is meant to be a well-oiled machine, if you will, or think of it as an orchestra with multiple players. And if one instrument in that orchestra is out of balance, in the audience, you hear it and it grates on you as you're listening. So you know that it's out of tune. Well, your body has the same strive to be in balance. And so I want you to think of your foundation of your health as the 4 chair legs of a chair that you would sit on, or 4 tires on a car. If one of the legs of that chair is broken and you sit on that chair, what happens? Boom, you're on the ground and you don't even know how you got there. Or one tire is flat on your car, you're not going anywhere. So your day just got ruined. You've got to change the tire. So think of the foundation of your health as the 4 foundational hormone groups in your body. So that's your sex hormones, in women, your male and female, in men, your male, your thyroid, but not just a TSH, all of how your thyroid functions. Your cortisol, which is your adrenal, that's your fight or flight, your stress hormone. Well, who's got stress, right? And
Yeah.
right. And lastly, your insulin. Now, insulin as a hormone, it's not just a treatment for diabetics. Insulin is a hormone your body makes in response to handling the food that you eat and how you manage your energy in your body. So those 4 hormones need to be in balance with each other and working at optimal range, or if one leg is broken, it forces the other 3 to try to compensate and come to the rescue. Well, as you compensate, might you stress another leg of that chair and break that one too? Now you're working on 2 legs. Might that put so much stress on those 2 legs that you break 1 or 2 more of those? In other words, I've had women and men who have said to me, I don't feel good and nobody can tell me how to fix this. And that was my favorite patient because I would check the 4 hormone groups, the very foundation of their health. And first they'd say to me, I've never had these labs done. So you're going to have to explain this to me. Okay, I will. But secondly, is we'd find they'd have us 1, 2, 3, or all 4 of those hormone groups out of balance. We'd put them back into balance and we could do it in 6 months, 9 months. And they'd say to me, Doc, I feel 15 to 20 years younger than my age. How do I keep this? I've got my moxie back. Well, we keep it by continuing to keep the balance. Just like you check the tread on your tires and you change a tire that's going bad. You continually check where you're in balance or if something is throwing you out of balance. And that's the key.
So that would be like an annual checkup or more frequently?
Well, for a lot of people, because you're dealing with a broken leg or more than one broken leg, you want to be scientific about how you get that leg fixed. So you're going to work on that leg, and the other legs are also going to respond to that. So most changes, if you make a change in your body will give you that answer back as it resettles in about 6 weeks. So I would check blood work again in 3 months, because that would be more than enough time to make sure that, if you started a new supplement, you were on it regularly. In other words, if it was a medication, you were compliant with it and you've been on it at least 6 weeks on a regular basis. So give your body a chance to respond to what the new change is. And you may find that you've caused other of those foundational hormones to settle down, or they may have been so stressed that they go the other way and they're realizing that, oh my gosh, now that pressure is off, but now they go, the opposite direction. And now they still need to be reeled back in because they had been so stressed. So it's all about, you get like a wave, you get your broken leg and then you get the rebound, and then you've got to recheck, and over time and space, that wave will settle out to a flat surface, but you have to give it space and time in order to work that rebalancing out. Meanwhile, life happens. So you still have to respond to life as it goes on. So I would check people every 3 months.
It feels like this is a very specialized knowledge that you have. And I don't feel like there are a lot of physicians who are willing to go to the lengths to understand this balance. Where do you find somebody like that?
Well, I'm in the process of doing a master course that doesn't help anybody right now, but realize that regular traditional medical doctors, like we've mentioned from the beginning of the podcast, they aren't taught this in medical school. So who is taught this information? Well, you'd be very surprised to know that naturopaths actually have a better handle on this information than medically trained MDs have. And that there are organizations that credential healthcare providers like 4AM, which is the American Academy of Anti-Aging Medicine. They will actually do certifications for healthcare providers on hormone balancing and optimal hormone health. But what I've done is written a book for the patient, for the everyday woman, to help them understand. They need to know what is happening in their own body so they can have an intelligent conversation and relay what's happening to them with their healthcare provider. So in order to educate the patient, that meant I need to put information out there that every patient, regardless, can read this and go, oh my gosh, that's me. And find a case study in there and go, oh my gosh, how did she know she was writing about me?
Right, right.
Right.
Yeah.
And the book that I wrote is Full Bloom,
Yeah.
Perimenopause, Menopause, Postmenopause, and Beyond, available on Amazon, but it's meant for every woman age 35 and up to say, oh my gosh, I need to know what is happening to my body. And the last chapter in the book is how to talk to your healthcare provider. Wow. So I'm giving you the list of labs, the 4 foundational hormone groups, to get drawn so that you can ask your healthcare provider, I want these labs drawn. This is why this doctor wrote this book. And I'm talking to you as I'm having these symptoms, and I would like to see where my balance is, or if I'm out of balance. Am I age appropriate or not?
Perfect.
So that's the purpose of writing the books. Is most physicians aren't going to read the book. They're going to rely on what they were taught in medical school. But if your patients are coming to you and saying, I want these labs drawn, and here's why, they're either going to listen to their patient and say, okay, let's do this. Show me that book. I'd like to take a look at that. Or if they are employed by a healthcare system or an insurance company, they may actually be unable to order that blood work for you because their boss, the system or the insurance company, says, you can't go there. We don't let you go there because we need, and this is nefarious, but we don't make money on keeping patients healthy.
We don't, right? Yeah. Yeah.
Right.
I hear that. Oh my gosh. Yes. But you think naturopaths would be a good way to go?
They are at least a great place to start. There are other online searches that women can do for bioidentical hormone specialists. And some are going to be good, some will be less than good. So my advice is to educate and empower yourself so you can have that honest conversation with any healthcare provider you are interviewing as to whether they can work with you.
Absolutely.
Now,
Yeah.
right. Now, you may also say, well, if my doctor won't do my blood work, how do I get that done? how can I get blood work done so that I can take it to that naturopath and have that first appointment with that new doctor be meaningful?
Mhm.
And that's a great question. So if your doctor won't do that blood work, you've already got the list. Women know you can go online and you can order your own blood work.
Yeah, I've done that. And I actually had my doctor tell me when I showed her the blood work that, well, you didn't need all of those tests. And I'm like, what?
But actually, you found value, I'm certain, in ordering that level of testing
I
that you
did.
ordered, right?
Yeah.
So, a lot of women, when they do get labs done through their doc, if their deductible is not met, the cost can be exorbitant. It can run into $1,000, $1,500, sometimes more. But if you are ordering labs yourself online, you are not going through your insurance, meaning your deductible, you don't have to worry about that. But you can, in many cases, use your HSA or an FSA. So check to see if that will work. But know that when you order your own labs, you are also paying at a highly discounted rate
Yeah.
for those labs. It is a much different scenario. I would draw the list of labs that's in there, and if their insurance wouldn't cover it, it could be as much as $1,500 to $1,800. Yet they would order the same labs themselves online, and it would be $350 to $400.
Right. Right.
That's a significant difference.
Yeah. And we're
And I'm not saying you need all of those labs every 3 months,
Mhm.
but in the beginning, you need to know where you stand,
Mhm.
and then you do some spot checking and balancing after that.
I love
So,
that. Yeah.
but know you have that ability to order your own labs, and then you get the results sent back to you, which
Mhm.
puts you in charge of
Right.
who sees those labs. They're not held hostage, or you get to look at your phone and you have to flip back and forth 5 different screens to find out what your lab results are, which loses the continuity of what you're looking at your labs for.
Right. Right. I love this. The book is fantastic. It's so informative. I love all the case studies you've got in there. And the advice at the end about what to talk to your doctor about is really straightforward. But in the beginning, talking about, what is estradiol, what is progesterone, what is testosterone, and how do women need these, and how much, and how do we know if we need them, and all of the charts and things that you have available, so people can look at their symptoms and get, do a little bit of self-diagnosis to begin with. What is it that my body's telling me? I'm all about listening to your body. That's what I do, is talk to bodies. And I think it's so important that women learn how to do that, how to really pay attention and not have to give that power away to a doctor. No offense, Dr.
No offense
Give that
taken.
power away, take that power back and remember that it's your body, you're in charge. You get to say what works and what doesn't work for you. And the physician that you work with is your assistant. Basically, they're there to help you with what you don't know how to do or what you need help with.
Right. And, so many of us have this image of our doctor has all of this knowledge. Well, they're telling you they can't go there, or they won't go there, or they don't know how to interpret these labs.
Mhm.
So I'm letting you know that you can be your own expert on your body. You live in your body, and you're simply educating yourself to have an honest back and forth conversation about your body with your healthcare provider. It's meant to be a conversation starter, not a I'm surrendering my symptoms to you, and whatever you say, I'll do.
Yeah. Yeah.
That's not a conversation, right?
That's not where we want to go anymore. We're done with that scenario. I look at at my mom and her generation, and how whatever the doctor said was, you know, gospel truth. Because we didn't know any better, you know,
Right.
just didn't know that they could take that power. And that comes from a long line of patriarchy and all of that. So that's a whole nother discussion. You know. Anyway, is there anything else? I mean, I love that this is really about giving women their power back, helping them take control, because it's their body. The more they know, the more they can feel empowered and feel like they're really getting the answers they need. And this book is amazing. I will make sure that people have a link to get the book when we publish the video here for you. Also, your other book, Blossoming, you want to talk about that really quickly?
Oh, well, thank you, Mary. Thank you very much. Yes, going on the same theme of understanding your body, we also have our adolescent nieces, daughters, granddaughters, that they were never told what's going on in adolescence as they go from puberty to womanhood. So many times a pediatrician, just like an internal medicine doc or GYN, that isn't taught in medical school. So they don't know what to do. And their answer with swinging hormone symptoms is, I'll put you on the pill. Well, a 16-year-old can't advocate for herself. She'll bring her mom along. Moms, sorry, but you were never taught this either. We went through adolescence blind, and we crossed our fingers and came out on the other side and went, whew, we made it. You know, I didn't kill anybody, and my mom didn't kill me. And, you know, and we laugh about it, but we had no knowledge. We simply survived. And as moms, we could only help our daughters through as best we could. But these days, our daughters and granddaughters have a cell phone and access at their fingertips to ask questions about, why do I get migraines before my period and my sister doesn't? Why do I have trouble sleeping and my friend doesn't? They're asking these questions, and there's no medical person helping answer them for them. So what I did is the same approach for the adolescent female, is dispel the myths, tell the truths, put the science in. Where should adolescent hormone levels be to be age appropriate? And newsflash, the hormone swings that happen in adolescence mirror the hormone swings that happen in their moms from 35 and up. So is it any wonder that there may be times they clash and times that they're meshed? So it puts the science into what is happening with adolescents and how can we help our daughters navigate it? Because they're struggling just like we did. We forgot we were there, but wow, our daughters bring it right front and center for us. Boom. And they want answers too. And if we can't give them answers, they'll look for them in places we may not want them looking.
And maybe not getting the right answers, right?
Correct.
Yeah. Wow, this is so great. I could talk to you forever. Any final words for us who are trying to make sense of all of this, what's going on in the body?
Take charge is really my best and favorite advice. Is, women, you deserve to know how your body works. So educate yourself, get the books, get other information, educate yourself and empower yourself to have a conversation that's meaningful with your tribe, with your healthcare provider. Your tribe is helpful too, because they may be using food as medicine. They may be using herbals as medicine. And that's a more holistic approach. It may be getting them some relief, but maybe not what they're looking for. So use your tribe, use your platform, use your medical personnel that you work with. But if they're not able to help you, realize you may like your doctor, but if they can't help you, you may need to find somebody else that complements what you need, not what they need, what you need.
Perfect. Thank you so much, Dr. Mondloch. And we will be publishing this soon on the Woman of the Wild Path YouTube channel. And we'll have a link to Dr. Mondloch's books, probably both of them. And she is offering a free, let me remind myself, it's a free symptom checker for hormone balance. It's a worksheet that she's going to provide just by you emailing her. So I'll have all that information along with the video. So thank you again. We really appreciate all of your great inspirational wisdom that you're sharing with us. And I hope you keep up this great work. I appreciate it.
Thank you so much, Mary. Such a pleasure to be here.
Take care.
Thank you for joining us today for Women of the Wise Path. Continue the journey with more conversation, events, and resources at the address below. We'd love to hear from you and what you would like to talk about. Together, we're shaping a future rooted in wisdom, collaboration, and the infinite power of the feminine spirit. Until next time, may we walk all together the wise path, guided from within.